Common question that I get asked is, what is Vaser Liposuction and how is it different to traditional liposuction? So Vaser Liposuction involves using an ultrasonic probe to liquefy or emulsify the fat before suctioning it out. Now this allows more precise liposuction and removal of fat from specific areas, but the added advantages is that because the fat is liquefied first, it allows a smoother removal of fat much closer to the skin and hence a greater removal of fat than traditional liposuction. If you were to use traditional liposuction, where it's essentially sucking solid fat with a metal cannula that close to the skin, it's very likely you'll create cannula marks and indentations which are very difficult to fix. Now, the added benefit with Vaser Liposuction is that in the melting of the fat, also heat is applied under the skin. That heat is going to promote new collagen production even after the fat is removed, and as the patient is recovering, the skin over the overlying area will undergo contraction, and the patient will not have to deal with loose skin laxities afterwards.
We get often asked, how does Vaser Liposuction actually work? It's not just suction, it's science. Here are the 3 steps. First, we infuse the area with a tumescent fluid. This swells the fat cells, numbs the area, and shrinks blood vessels to reduce bruising. Next, the Vaser probe emits ultrasound energy. This sound energy targets the fat cells specifically, liquefying them while aiming to preserve nerves and connective tissue. Finally, because the fat is now liquid, it can be removed through a gentle suction process with less trauma to the body. With this technology, while it is sophisticated, remember, it is surgery. Risks include infections, burns, and asymmetry.
Another common question that I get asked frequently is the difference between Vaser Liposuction and Vaser Hi Def, Vaser HD, ab etching. They all relatively mean the same thing. So with Vaser Liposuction of the abdomen, generally the idea is to remove as much fat as possible, try to get sort of subtle vertical ab definition. Now high def, ab etching, that's when you're really trying to take the fat out between the muscle bellies of your six-pack muscle or the rectus abdominis to get that six-pack or four-pack look. Now I do that very selectively on patients because it's not just about removing the fat. At the end of the day, the result has to look realistic and be believable they are your abs coming through. Whilst everyone has those rectus abdominis muscles, taking the fat away will reveal them. You're really requiring the Vaser to be able to tighten and contract the skin to the extent that the overlying skin is almost shrink wrapped over the muscle bellies to make it look realistic. So patients that have slightly loose skin from various reasons, or their rectus abdominis muscle isn't very bulbous to be able to almost poke through the skin, I tend to not do the high def. Because ultimately, results of liposuction is trying to make things look realistic and completely believable that it's real.